Hey, it's Dr. Rory Cernik with the Hearing Assessment Center offices locally in Hunt Valley, Lutherville, Perry Hall, Bel Air. Interesting conversation I had today with a patient. We were talking about the connection between alcohol abuse and being socially isolated. So is being isolated worse for our health than consuming alcohol? We know there's known alcohol risks as well as social isolation or loneliness risks. Abuse of alcohol increases cardiovascular disease, increases blood pressure, creates liver disease. But recent data indicated that being socially isolated may be more, again, harmful than consuming large quantities of alcohol. From a hearing loss perspective, we know that untreated hearing loss will limit our social interactions, and this is going to lead to isolation and loneliness. So the progression I always talk about in general in the office is that most people wait about 7 years before when they first realize they have some hearing issue until they have a test. But at that point, it might be too late. What happens with hearing loss, it creates embarrassment. I bet we all know someone who is embarrassed or they don't contribute from a social perspective just because of their hearing loss. And so hearing loss, it's there, it progresses, it creates isolation, embarrassment, frustration, loneliness, and then for some, even depression. But again, the point of this is that being socially isolated as a result of hearing loss is equivalent to consuming 15 cigarettes per day, but also to alcohol abuse. So, interesting thought. But if you know anyone who is becoming more embarrassed or isolated or lonely because of suspected hearing loss, give us a call. We'll see if we can help. Dr. Rory Cernik, Hearing Assessment Center. For more information, visit the website. I'll also include there an ebook with more information on hearing loss and the consequences thereof. Take care.